They say it's the epidemic that no one talks about. But in this tiny community, Pozo Verde in eastern Venezuela, it is clear for all to see. The jaundiced complexion, the weariness, those telltale symptoms of malaria.
Sí, tengo las dos.
Inelis is currently suffering from both malaria and dengue at the same time. Robin says the mosquitoes are everywhere.
I wake up with bites all over my arms and legs.
There have been almost 10 times the normal number of malaria cases in this small settlement this year. There are two reasons why. One is there's been a surge in illegal gold mining in mosquito-infested areas nearby as people struggle to find new ways to earn a living. The other is that this country has almost no anti-malarial drugs, so the pool of infected people is growing. Here in Caracas, there's an additional complication. The government has declined to release updated malaria statistics since early 2015.
Ciudad Universitaria in the area.
Experts like Dr. Jaime Torres, director of Venezuela's Institute of Tropical Medicine, are dealing with this crisis with only semi-official information.
This very year, we have close to 150,000 cases, which is more than we ever had before we had the control program of malaria.
But without government figures, how do you know how serious a problem it is?
Okay, that figure that I mentioned is a government figure. It's just that it's not publicized officially.
Maybe because it's all too depressing. In the 1960s, following intense eradication efforts, Venezuela was officially declared malaria-free by the World Health Organization. Now it risks exporting the disease to its neighbors. So what's the government doing? In the capital, there are some fumigation efforts.
The government is renewing all of its resources so that we can fight the transmission vector for this illness.
But this is primarily against Zika and dengue. Fortunately, the altitude of Caracas is too high for malaria-carrying mosquitoes. The key problem is in the rest of the country, where malaria can thrive and resources are exceptionally limited. Here, residents told us there hadn't been fumigation for 2 years, and the malaria surge is really symptomatic of a bigger disaster, a crisis in Venezuela's public health system.
Well, it's desperate. I mean, you have a collapsing of the public health system, both in coverage and the quality of care that it provides. You have a shortage of drugs for the treatment of many diseases, including malaria specifically. We probably are facing the worst health crisis that we have experienced in, I don't know where in the history, but in many years at least.
And as often happens in these situations, it is the most vulnerable that get hit first and hardest. Stephen Gibbs, CCTV, Bolivar State, Venezuela.